Under the Needle, where acupuncture meets anatomy. Today, we're exploring spleen 12, one of the most commonly used points in clinical practice. Spleen 12, or Chongmen, is located in the groin region just superior to the inguinal ligament and lateral to the femoral artery. This point sits at the transition between the lower abdomen and proximal thigh. The area serves as a major passageway for nerves, blood vessels, and connective tissues traveling into the lower extremity. Because of its location, spleen 12 is closely associated with lower limb circulation, hip function, and neurovascular regulation. The most significant structures associated with spleen 12 include the inguinal ligament and the neurovascular bundle of the femoral triangle. The femoral nerve emerges beneath the inguinal ligament and provides motor and sensory innervation to the anterior thigh. The femoral artery and vein pass through this region and serve as major vascular pathways for the lower extremity. These structures create an important anatomical relationship between movement, circulation, and neural function. Together, they make spleen 12 one of the most clinically significant neurovascular regions in the body. Clinically, spleen 12 is frequently associated with groin pain, hip dysfunction, and conditions affecting the anterior thigh. Because major neural and vascular structures pass through this region, dysfunction may influence movement patterns, sensation, and tissue perfusion throughout the lower extremity. Restrictions around the inguinal region may also affect hip mechanics and gait. For clinicians, spleen 12 represents an important anatomical gateway between the trunk and lower limb. In traditional Chinese medicine, spleen 12 is commonly used to regulate qi in blood and harmonize the Chong vessel. The point is frequently selected for disorders involving the lower abdomen, pelvis, and groin. From an anatomical perspective, spleen 12 lies adjacent to the femoral nerve, femoral artery, and femoral vein. These structures influence circulation, movement, and sensation throughout the lower extremity. When these perspectives are integrated, spleen 12 reflects both traditional concepts of regulating energetic flow and modern understanding of neurovascular function. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.